Hey everyone, this is Hannah with the Rocket Miner. Wanted to give you another news update video. Today I want to spend some time talking about where we're at with COVID-19, and please don't tune out just because I said that. That will be the focus of today's video. I know that I give a lot of COVID updates. I know we've heard a lot of news about that recently, but I want to spend some time talking about why it's important for us to keep giving those updates and keep paying attention to that news. But to start, I just want to give you some of the specifics of where we're at as far as the numbers and some new updates concerning COVID in Wyoming. Today, the Wyoming Department of Health is reporting that we are up to 8,537 confirmed cases. This has gone up by 232 since yesterday. We're up to 1,582 probable cases, which is up by 39. Today, with those combined numbers of confirmed and probable cases, our total for COVID-19 cases that we've seen in Wyoming up to this point just passed 10,000 for today. With those numbers, we're at 10,119. Today, that leaves us at 2,831 active cases. This has gone up by 114 since yesterday. So all of those numbers have continued the trend of the past few weeks of just going up in significant amounts every day. Today, unfortunately, the COVID-related death total also went up. It was at 61. Today, the Wyoming Department of Health reported 7 new deaths. So we're at 68 total coronavirus-related deaths for Wyoming. These 7 new deaths that were added today were residents of Goshen, Campbell, Uinta, Natrona, Laramie, and Albany counties. They were all older adults. 5 of the 7 were known to have health conditions that put them more at risk from COVID-19. One of the men that died was not known to have any pre-existing health conditions. And for one of the other deaths, it was unclear whether or not they had pre-existing health conditions. Most of these people were hospitalized at the time of their deaths. I would like to again remind everyone that just because these were older adults and most of them did have health conditions that put them more at risk, that doesn't mean that they were dying or that they were just going to die soon anyways. I've seen a lot of people that are still making that argument, and it's just not an accurate argument, and it's not a compassionate argument. Most of these people most likely would have gone on to live hopefully much longer were it not for them contracting COVID. So those new deaths have been added to the total, and as I said, that puts us at 68, and just all of our condolences go out to all their family and friends that are affected by this loss. I also wanted to note in connection with this one thing from yesterday's press conference. Governor Gordon, Dr. Alexia Harris, and a few others gave another press conference and gave a really good update on where things are at with COVID-19, made a lot of really interesting and good points. So we definitely encourage everyone to go watch that if you haven't. Also watch Caleb's update video from yesterday on our channel. He did a good job going over the highlights of that press conference and a lot of the main points that were made. So you should definitely watch those if you haven't, because there were a lot of really good points. But one thing that Dr. Alexia Harris pointed out during the press conference was how our current COVID-related death total relates to deaths we've seen previously from flu seasons. At that point yesterday, there were 61 deaths. As I said, today that's gone up to 68. But even when it was at 61, Dr. Harris noted that that number is far more than double the number from our worst flu season in decades. Looking at the deaths over a similar period of time, that is over more than double what we've seen from flu seasons in Wyoming. A lot of people are still comparing COVID to the flu or to colds or to other sicknesses. And yes, people definitely die from the flu and from other sicknesses, and that is also a tragedy that those numbers are that high, but it is just not accurate to compare COVID to those other sicknesses. The death rate and everything else is not comparable in the way that people have been comparing it. And I think Dr. Harris noted that, especially for Wyoming, we can see how this is very different than the flu, and the way that it's affected and impacted our community and our state is very different. So it's something that we need to look at differently and to take seriously. Also today, Memorial Hospital of Sweetwater County sent out a great press release. It's up on rocketmeyer.com. Definitely encourage you to read it, giving some updates on where the hospital is at and some of the things that they've been noticing recently here locally in Sweetwater County. As of the last update on their site, the numbers looks like we're at about 45 active cases here in Sweetwater County right now. They noted that they have seen the number of positive cases going up, especially over the last 2 weeks here in Sweetwater County. They're continuing to do their swabbing station and collecting samples and doing tests for COVID. They said they continue to collect anywhere from 50 to more than 100 specimens a day, and very soon they're going to reach their 10,000th swab. So they've been doing a great job keeping up with doing lots of testing so we can see where our numbers are at here locally and what that means. They did note that they have seen the positive cases going up. The percentage of cases that were positive had been dropping. It had dropped even below 2%, but over the last month it's gone up pretty drastically. It was at 1.6% on October 1st, and it's now at 5.1% as of the numbers yesterday. So that has gone up dramatically for here in Sweetwater County. They noted that so far, up to this point this year, we've been one of the better counties in Wyoming for where our numbers are at and how we're doing. And they just said that they really hope we can get back to where we were, get back to being one of the counties with a lower number of cases and positive tests. Along with that press release, they gave more information and updates and statements from some of the doctors. And with it, they included a photo that shows all of the doctors at the hospital wearing masks and standing with their arms apart, demonstrating social distancing. They said that they wanted to take this photo to show that all of the doctors at the hospital are on board. They all believe in the benefits of wearing masks and social distancing and taking these precautions. So they wanted to show that they are taking these precautions, they take them seriously, they think they're important, and they want to encourage everyone in our community to do the same. Sweetwater County Public Health Officer Dr. Jean Station said that the hospitals and the organizations here locally are doing as much as they can, but that they need the community's help. She said, "We can't do it unless the community is cooperating and doing what they need to do. It doesn't take much to blow it all up. It's like a Jenga game. You can pull out one piece and it crumbles really fast." Obviously, we've seen that to some extent over the past month, even here locally, as that positive percentage has gone up for the positive cases. We've seen how quickly it can escalate and things can get out of control, and that can have really negative repercussions for everyone in our community. So we need to take that seriously, to realize how quickly it can get out of control, and to realize the actions we can take to help keep that from happening, to get back down to where we were before, so things are more in control and we're one of the counties doing better, and hopefully can encourage the rest of Wyoming to keep doing better. We all need to do our part in making that happen. And as I looked over these stories and these statistics today and just over the past couple of weeks, had some more thoughts. Some of these are things that I've said before, things that I've already encouraged people with about how we need to respond and what we need to do. But I wanted to just take some time to talk about some of those ideas again. I think one of the important things is to realize that we can't ignore this, that ignoring it won't make it go away and won't make it better. This is the time when it's more important than ever to be aware of what's going on and keep up with the information so that we can do our part. At the end of May, I wrote a column for the paper that was entitled, "Just because we're over it doesn't mean it's over." And I look back now and I'm thinking at that point, we were barely at the beginning of it. At the end of May, it had started getting a little worse, but it still, especially here locally, wasn't that bad yet. But at that point, it just seemed like it had been going for so long and I was so tired of having to deal with it. But I knew that it was important to keep listening to health officials and keep taking precautions, which is why I wrote that column. Now, several months out from that, things have only gotten worse. Actually, right at that point when I wrote that was when the health orders were starting to relax. We were starting to move forward to be able to do more things. We thought, this is getting under control, this is getting better. And my mentality was, we just need that last little push to keep doing what we're supposed to get it better. Unfortunately, it was right after that in June when things started spiking and things started getting much worse. And it's been really interesting for me to think back over the past few months and kind of some of the mentality shifts and even in the way that we report things. I know that at the beginning of this, we were reporting every single active case locally because it was slow enough that we could. We were seeing 1 or 2 new cases every week. We would report them so that people knew they were happening. At that point, a lot of the people here locally decided we don't need to record every single case. We don't need to report that specifically every time. We'll just give an overall look. And again, that was kind of out of a mentality that we thought things were getting better and slowing down. And ironically, it went the other direction where things got much worse. And it got to the point where we couldn't keep up with reporting every active case even if we wanted to. There's no way, especially right now. As I said, we probably have about 45 active cases in Sweetwater County. There's no way we could report every single one. We don't have the time or energy for that. None of us do. But I think it's important to realize that this means that our mentality, we need to be even more careful than we were before. And we need to realize where things are at so that we know how to respond to them. And I think that along with this, I think it's important to keep in mind that we have to take care of our own mental health. I know that for so many people, it causes a lot of anxiety to just see the numbers going up every day. It can become almost a compulsion to keep checking the numbers, to keep checking how much have they gone up, how much was it since yesterday. I'm guilty of that. I get a little compulsive about checking the numbers and knowing how much it's changing. And that can get to where it's not a healthy thing for people, where you get too fixated on the numbers. So I definitely understand when people need to take a step back and not constantly be checking and hearing all the updates. Completely get that. People need to do whatever they need to do for their own mental health. Definitely encourage that. But I think the important thing is to be aware of the overall trends. Like, even if you don't keep up with the specific numbers and how much they've gone up every day, just be aware that they're going up. Be aware of what's happening so that you can know how to respond to it personally. I think as a newspaper, it's important for us to keep updating you on the numbers, to keep giving you specifics so that you are informed and you can choose whether or not you want to look at all of that information. So I think we'll keep doing our job of keeping you informed on the details. But I just want to encourage people to just be aware of what's happening to whatever extent you're comfortable with and what is most helpful for you. Just know what's going on so that you can know how to respond. And I think that we just need to keep doing our part and keep doing as much as we can. COVID is a constantly changing situation. We're constantly learning more about it and more about what our response can be. Our scientists, our health officials, and doctors are continually doing research and adjusting the recommendations that they give. You think back over the past few months, there was a time when the recommendation was to always sanitize your groceries after you went shopping. And for a while I did that because that's what was recommended. I would go to the grocery store, I would come home, get a Clorox wipe, and wipe down every single thing. I was honestly really relieved when the CDC said that that wasn't necessary, because that was kind of a pain and it was time consuming to have to do that. But as I look back, I realize, like, I don't feel stupid for having done that, because that was the recommendation at the time based on the information they had. When they had new information, they updated it. So the recommendations are constantly changing. We need to listen to the health officials and what they are recommending and what they do think is helpful. And I think a similar argument with that applies to masks. And I know I've talked on here about masks before, and I stand by the things that I've said. I think even more than ever now, there is proof to show that they are important and they are helpful. And there is research that backs that up. Most health officials agree on that right now. So I think it's very important for us to continue wearing masks. But a lot of people still aren't totally convinced that masks are helpful. But even if we look back and realize that it's like sanitizing our groceries, maybe it was a step further than what we needed to do. But we were just doing as much as we could to stay safe and to protect each other. And if we look back and say, maybe that wasn't totally necessary, I still won't regret having done it, because we're just doing as much as we can based on the information that we have. And I think that that's important. And this doesn't mean that we're living in fear. It just means that we're being as careful as we can be. You think about things like seatbelts. You don't wear a seatbelt because you're living in fear. It's the law, it's mandated because it is something that keeps people safe. And people argue that we shouldn't wear masks because either you're living in fear or people shouldn't tell us what to do and how to live our lives. But when my actions affect the people around me, there is an extent to which the government and officials and experts can tell us what to do in order to keep other people safe. And I think that that's important to keep in mind, and to have that mindset that it's not about them controlling us. It's not even about our personal choices to an extent. It's about how we all work together with the information we have to keep each other safe and to do what needs to be done. So I would just encourage everyone to know what's happening. Now is the time where it's more important than ever to be informed, to know where we're at, and to take actions in response so that we can be responsible. Listen to the experts, do the things that they're asking you to do. None of them are very hard. They're a little inconvenient, but it's really not asking that much. So keep taking those steps, taking those precautions, and hopefully we can get back to a point where we can get over this spike that we're seeing in Wyoming. We can get those numbers back down and just keep moving forward together and taking care of each other. Just wanted to encourage everyone with that today. Thank you so much for listening, and I hope everyone has a good night.